Hello. Have you been dealing with pelvic pressure, a bulge, or leaking urine when you laugh or cough? You might have heard about pessaries but wondered what they really are. Today, I'll explain how these simple devices can dramatically improve your quality of life without surgery. Stick around. I promise to answer all your questions. Welcome to Women's Healthcare Answers. I'm Dr. Jeff McQueary, a Tennessee urogynecologist. And if you're new here, hit the subscribe button. We're here to empower you with knowledge, one topic at a time. Well, what is a pessary? A pessary is simply a removable device, usually made of soft silicone that we insert into your vagina to support your pelvic organs. Think of it like an internal bra that holds up the place. Well, your pelvic organs, the bladder, uterus, and rectum, are normally held in place by muscles and ligaments. But after childbirth, menopause, or just aging, these supports can weaken. That's when organs can drop down and cause that bulging or pressure feeling you might be experiencing. But make sure you watch until the end because I'll share practical care tips and helpful life hacks that pessary users love. What do pessaries help with? Well, number one, pelvic organ prolapse. When your bladder, uterus, or rectum drops into the vaginal space, you might feel pressure, heaviness, a bulge, or even see something coming out. You might have trouble emptying your bladder or bowels, or feel discomfort during sex. A properly fitted pessary lifts these organs back up and holds them there. And studies show that 50 to 85% of women get excellent relief with pessaries. Many say it's just life-changing. But number two, stress urinary incontinence. If you leak urine when you cough, sneeze, laugh, or exercise, certain pessaries can help by supporting your urethra. Research shows again that 40 to 75% of women see significant improvement with these type of pessaries. Well, who should consider a pessary? Well, pessaries are best if you want to avoid surgery or try conservative treatment first. If you have a health condition that might make surgery risky, you want something you can control and remove anytime. Maybe if you're planning future pregnancies, if you're waiting for scheduled surgery, you had surgery that didn't work or came back. Well, these are all reasons. But also, if you're sexually active and want a solution that doesn't interfere with intimacy, you may be able to find something that works for you. But so how do we fit a pessary? Well, fitting happens right in my office during a regular appointment. Here's what to expect. Well, step one is we'll do an exam. I'll do a pelvic assessment to see what type of prolapse you have and really measure the vaginal area. Step two, we'll pick a pessary. This is based upon your exam. I'll choose a starting size and type of pessary that I think would work best for you. Step three, try it out. I'll insert it and have you walk around, sit, stand, cough, and use the bathroom. We're looking for something that stays in place, doesn't hurt, and relieves your symptoms. So the fourth step is adjust as needed. It's completely normal to try several sizes before we find your perfect fit. Don't be discouraged. Most women find the right one within the first 1 to 3 tries. And step five, you learn to care for it. I'll teach you how to insert, remove, and clean it yourself, or you can return every 3 to 6 months for cleaning and replacement if you don't feel comfortable doing it yourself. Finding this helpful? Well, give it a thumbs up and share with someone who might benefit. So what are the types of pessaries? There are over a dozen types of pessaries, but most of them are not very commonly used. Let me talk about the most common that you will see. Number one, the ring pessary. It's the most popular. It's a simple circle design. It's easy to insert and remove yourself. It usually can stay in during sex, and it's best for mild to moderate prolapse, and its success rate is somewhere between 50 and 60%. Then there's a Gellhorn pessary. This is a knob shaped with a stem. It's great for more severe prolapse and it stays in place really well. You usually need to remove it every 3 to 6 months, and you can't really wear it during sex. So being sexually active with this type of pessary is difficult, but the success rates are high at 70 to 85%. Then there's a cube pessary. This is a six-sided cube that uses suction. It's excellent for severe prolapse. You must remove daily for cleaning, and you can't wear during sex. And then there's the incontinence ring. This is a ring with a knob that supports your urethra, specifically for stress incontinence. They're easy to manage yourself and can usually stay in during sex, but it may be something that you want to remove. With patients, about 60 to 75% of women find a pessary that really works well for them. How do you care for a pessary? Well, self-managed, the ring type you remove daily or weekly, whatever works for you. You can wash with mild soap and warm water. You can rinse thoroughly and dry and reinsert using a water-based lubricant. But if it's provider managed, meaning this Gellhorn or the Cube, or even some rings where patients don't want to deal with it, you'll come see me every 3 to 6 months for cleaning and checkup. Well, now about critical care tips. You should use vaginal estrogen. This is huge. If you're postmenopausal, vaginal estrogen keeps your tissues healthy, reduces irritation, and prevents problems. I recommend it for almost all my pessary patients. But the number two, we need to watch for problems. So call if you notice foul-smelling discharge, bloody discharge, increasing pain, trouble urinating, or the pessary just keeps falling out repeatedly. That is a big concern. Number three, don't forget it. Never leave a pessary in for months without cleaning. If you do that, we can certainly do that. If we tell you to do that, that's appropriate. But this can cause serious problems like erosions, infections, or even fistulas. Keep track of your care schedule and make sure that you have your visits. Number four, use water-based lube only. No oil-based products or petroleum jellies. They can damage the silicone. Now let's address some common questions. Will it be uncomfortable? Well, really, if it's uncomfortable, it's the wrong size or type. A properly fitted pessary should be barely noticeable. Let me know and we'll adjust it. Will I have discharge? Well, some clear to white discharge is normal. A foul-smelling or colored discharge needs evaluation. We can manage this with more frequent cleaning, vaginal estrogen, or occasional treatment if needed. What if I see blood? Well, blood usually means the pessary doesn't fit right for you or you need more estrogen. Call me, we'll fix it. Usually the tissue heals in 1 to 2 weeks, then we'll try a different size. Next question, can I have sex? Well, a lot of ring pessaries can usually stay in during sex, but most couples don't even notice it. Other types, such as the Gellhorn or the Cube, need to be removed first, but if intimacy is important to you, let's make sure we pick a type that works for your lifestyle. So how long can I use it? Well, as long as it works for you. I have patients who've used pessaries for over 15 years. The device itself should be replaced every 1 to 2 years, but there's no time limit on how long you can use one. Another question, what if it falls out? Well, this can happen, especially with bowel movements or severe coughing. Just keep it and reinsert it, or if it keeps falling out, we'll try a larger size or a different type of pessary. So let's talk about a life hack for pessary users. Keep a small pouch in your purse with a travel size, a water-based lubricant, personal wipes, clean plastic bag in case you need to remove it temporarily, or a written note of your pessary size and type. This is a lifesaver when traveling or away from home. So in other words, why would you use a pessary? Well, let me tell you why I love recommending pessaries. Immediate relief is the main thing. No waiting for recovery. It's also non-surgical and completely reversible. It's much less expensive than surgery, and it lets you exercise, travel, and live normally. You control when you use it, and success rates are comparable to surgery for many women. And research shows that women who find the right pessary are just as satisfied as those who have surgery. It really comes down to personal preference and what fits your lifestyle. When pessaries might not work for you, pessaries aren't right for everyone. They may not work if you have a very severe prolapse, very short vaginal length, very wide vaginal opening with poor muscle tone, an active infection. We can treat this first and then try a pessary, but also the inability to return for follow-up is probably a reason not to use a pessary. But if a pessary doesn't work for you, that's okay. Surgery is also highly effective. Neither choice is a failure. It's about finding what works for your body. And thank you for learning about pessaries with me today. They truly are a powerful option for improving your comfort and quality of life without surgery, without recovery time, and with complete control in your hands. Pessaries have been helping women for generations, and modern silicone pessaries are more comfortable and effective than ever. If you're dealing with prolapse or incontinence, I encourage you to ask your doctor about trying one. If this video helped you, please like it and subscribe to Women's Healthcare Answers for more practical advice, evidence-based content, and share it with someone who might benefit. And drop your questions in the comments. I'll read them all and will answer them personally. Remember, you're not alone in this journey. There are excellent options to help you live comfortably and fully. See you next time, and take care. This is a disclaimer. This video is for informational purposes only and should not replace medical advice. Always consult your healthcare provider for guidance tailored to your individual needs and condition.